Okay guys, in this video I'm going to show you how to hold a face mask. So it's very important to learn how to hold a face mask for a number of reasons, but the main ones are whenever you're any kind of doctor in any kind of specialty, if someone does collapse, it is important to be able to get a good seal over someone's face and to be able to deliver air or oxygen to somebody. Now, when you come to us in the operating theatre, you'll hear us talking about pre-oxygenation quite a bit, and this is important. We want to get lots of oxygen into somebody's lungs before we stop them breathing, before we give them an anaesthetic. If we have any difficulty in getting the breathing tube in, we want them to be full of nice, delicious oxygen in their lungs so that they have got many, many minutes, up to 7 minutes of apnea before they start to desaturate. So you can see that Kumar is holding a mask here over Irla's face. This is our first option for holding a mask, and I'm just going to move a little closer now. So he's just holding the mask gently on Irla's face. You can see that the mask is got a nice kind of squishy air-filled cushion around it. It's over the bridge of Irla's nose. It's covering both edges of his mouth and it's covering his chin. You can see that as he breathes out, the mask is misting. So this tells you that you've got a good seal. Another way that you can tell that you've got a good seal and that he's breathing in all that oxygen is that on all of our monitors we have end-tidal CO2 monitoring, and that's that white line that you can see there. Each time Irla breathes out, he of course breathes out carbon dioxide, and each time he breathes in no carbon dioxide. So it drops back to 0 as he breathes in, and as he breathes out, our CO2 rises again. You can see the number on the side, it's up in the 5.7 there now. So that's how Kumar can tell that he's got a good seal on Irla's face. Down in the bottom left-hand corner of the screen, we can see our oxygen levels. We have in white, on the bottom, 98%, FI 98%. That means Irla is breathing in 99% oxygen, and then ET 75%, that's end tidal 75%, that's how much he's breathing out. Before someone gets an anaesthetic, we generally wait until the end tidal is 80% or higher, so that we know that we have the lungs full of oxygen before we give an anaesthetic. So that's what Kumar is doing here now. So if you have difficulty getting a seal in this way, say if somebody has different facial anatomy, if they have no teeth, or if they're quite large, there's another way that we can hold the mask, and this is a gentle C grip. So you'll see it, that's Kumar's thumb and index finger, so he's going to do that on both sides of the mask, just very, very gently. He's not putting pressure underneath Irla's neck here at all. What he's doing is that using his thumb and index finger, he can manipulate the mask around Irla's nose, around the edge of his mouth, and around his chin to get that seal that he needs. So that's another way of holding a mask. If you're holding a mask like this, keep your hand away from the patient's eyes. This can be really claustrophobic and unpleasant for some patients. So you don't want to be covering their eyes. They're already scared when they're having an anaesthetic and surgery. So that's two ways to hold a mask when a patient is awake. When a patient is asleep, we can do the full CE grip. So this is Kumar doing the CE grip. So he has a C made with his thumb and index finger, and he's going to put downward pressure with the C. He's not going to press too hard because Irla isn't asleep, but you can press down quite firmly, so that's masked down onto the face. Using the other 3 fingers on his hand, he is going to do mandible, mandible, angle of the jaw. So this is your E, these 3 fingers here. And what he does is he lifts the mandible up into the mask using the E. So that's down with the C, up with the E. When you're starting out, this can be difficult, so you do it with both hands. So Kumar is going to show you a CE grip with both hands here. We do it with one hand because we're practiced, and we use our second hand to bag the patient, squeezing the bag. Now, this is the final way to hold a face mask that Kumar is going to show you. This is the way that you can do it if you're struggling, and particularly if you're not used to holding a face mask. So using your thumbs and the heel of your hand up on the mask, you use the thumbs and the heel of the hand to press down, and you use all the other fingers in your hand to pull the jaw up from the angle of the jaw and all along the edge of the mandible up into the mask. So that's 4 different ways to hold a face mask. Gently holding it at the top, the C grip, and then when they're asleep we have the full CE, and then we have the thumb and heel of the hand pressing down. So that's 4 different options to hold a face mask. It doesn't particularly matter how you hold it, as long as you're getting a seal, getting the oxygen into the patient, and that you're not distressing them when they're awake before they've had their anaesthetic. And now we can see, as Kumar has been pre-oxygenating your legacy, his end tidal O2 is 90%. Very happy to anaesthetise Ireland now. He's ready to go. He'd be apneic for 7 minutes easily there, no problem, nice and pink. And that's how we hold a face mask.